Part 2 of Chapter 21, the lymphatic and immune system. B cells have nearly all the development in the red bone marrow. T cells are created in red bone marrow but mature in the thymus gland. The thymus gland is a bilobed organ between the sternum and the aorta. You can think of the lymph nodes as the filter of the lymph. Bacteria that infects the interstitial fluids are transported to the regional lymph node. Lymph nodes are the site of adaptive immune responses. And remember, these are mediated by T and B lymphocytes. The spleen is a major secondary lymphatic system organ. The spleen has an extensive blood supply and lots of macrophages and adaptive immunity cells. There are lymphoid nodules. These are similar in design to the spleen and lymph nodes with dense clusters of lymphocytes. However, they're located in the respiratory and digestive tract. One example of lymphoid nodules are your tonsils. These pictures from your textbook show you where the various tonsils are at, the pharyngeal tonsils, the palatine tonsils, which we often think of with especially children with becoming infected and then sometimes being removed. You also have the lingual tonsils as well. In the actual photograph on the bottom right, you can see the palatine tonsils that are swollen due to infection. It's thought the purpose of the tonsils are to learn environmental pathogens and to develop immunity in childhood. The inflammatory response is part of the innate immune response, and it's the hallmark of that innate immune response. The purpose of inflammation is to recruit phagocytic cells to the damaged or infected area to remove cellular debris and set the stage for tissue repair. It's also designed to bring in cells of the innate immune response. And part of this response is acute inflammation, which is a short-term response. If the cause is not eliminated by this acute inflammation, it may lead to chronic inflammation. Chronic inflammation is ongoing inflammation which can lead to major tissue destruction and fibrosis. Listed here are some important aspects to the immunity response. To the inflammatory response. Number one is tissue injury. Tissue injury stimulates the release of granules from mast cells. Mast cells carry granules of histamine and heparin. The second important aspect of the inflammatory response is vasodilation, which leads to increased blood flow. This also causes heat and redness. Third, increased capillary permeability, allowing plasma to leak into the interstitial fluid. This causes swelling and edema. And fourth, phagocyte recruitment. These are neutrophils that are attracted to the site to clean up debris. And we can see on this graphic that as we look at the left side of it with granulocytes, we can see that the neutrophils are granulated white blood cells that help in phagocytosis. Sometimes the immune response becomes overactive, however. Our immune response is designed to protect us. However, things can go wrong. It can be too weak or too strong in its responses. The immune system is very complex, using many types of cells and chemical signals. Inherited immunodeficiencies come from gene mutations that affect components of the immune system. Immunodeficiencies can also be acquired, such as human immunodeficiency virus, or HIV. HIV wipes out the entire immune system over a period of time. HIV is spread through semen, vaginal fluids, and blood. HIV was first identified in the United States in 1981, although through further research and technology, researchers know that it existed in the United States since the 1970s. Over a period of many years, the immune system is destroyed and infected people die from opportunistic infections. At the present time, there's no cure. However, treatment is improving by targeting certain proteins that are necessary for viral replication. There is currently no available vaccines for HIV either. With some people, hypersensitivities become a real problem. There's 4 types of hypersensitivities that have been identified but are caused by unrelated mechanisms. Type 1 is called immediate hypersensitivity. This is usually a rapid response and occurs within a few minutes. Major symptoms of inhaled allergens are nasal edema and runny nose caused by increased vascular permeability and increased blood flow of nasal blood vessels. Reactions can range from mild allergies that are treated by antihistamines to severe reactions causing anaphylaxis and death. Type 2 hypersensitivities occurs with mismatched blood transfusion and blood compatibility diseases. Type 3 hypersensitivities occurs with diseases such as systemic lupus. The CDC considers SLE an autoimmune disease. SLE causes damage to blood vessels in the kidneys, joints, and other organs. Symptoms can be fatigue, skin rashes, fever, pain, and swelling in joints, according to the CDC. Type 4 hypersensitivities are called delayed hypersensitivity. This is our standard cellular immune response. With first exposure to an antigen, there is sensitization. On re-exposure, the immune system reacts. This reaction could take 24 to 72 hours. An example of this type of reaction is a tuberculin skin test for tuberculosis. Another example of contact sensitivity is poison ivy. Autoimmune responses. Autoimmune diseases are caused by an individual's immune system attacks their own bodies.